So as we mark the first 100 days of President Trump's second term, we also mark 100 days of Elon Musk and the Department of Government Efficiency, also known as DOGE. Musk taking a chainsaw, as you see there, to the federal government, driving efforts to shutter entire agencies and slash the federal workforce. So let's bring in tech journalist Yasmin Khorram to talk about the 100 days of DOGE and actually how Musk claims he's done okay, but how has he done so far?
Yes, so initially Elon Musk promised to cut $2 trillion from the federal government. Now that number has shrunk by a lot. What has DOGE accomplished? Let's run through some numbers. 120,000 federal employees terminated, either laid off or offered buyouts. According to the DOGE website, it says that it has saved $160 billion now. We don't have the documentation for all of that or the receipts. Keep in mind, that is less than 8% of the original $2 trillion promise. Entire agencies have been dismantled, such as USAID, CFPB. Other agencies such as the FDA, HUD, Department of Education have all been affected. Now, what's interesting here is that there's experts who warn that all of these firings and rehirings and budget slashes could actually cost taxpayers upwards of $130 billion this fiscal year alone.
So let's talk about Musk's companies. He was running the companies on top of running DOGE. So walk us through how his businesses fared through kind of this double job.
Yes, so the federal government isn't the only thing. It is the only thing that saw its size kind of go down. Tesla was hit hard this year. So, over the past 100 days, we've seen Cybertrucks burned. There's been protests outside of dealerships. Tesla has done so bad that last week, Elon Musk got on his earnings call with his investors and assured them that he would be stepping away from DOGE, would only spend about 1 to 2 days a week starting in May, and he would become an active CEO again. I mean, things got so bad that at one point we saw President Trump parade out Teslas onto the White House and tell people to buy them in order to boost Tesla's stock price. We've also heard from cabinet officials talking about how great Tesla is. So Musk telling his shareholders last week after a really bad earnings report, first quarter, he is going to be an active CEO again. I've been talking to Tesla investors. They're not happy about that. They tell me that the damage is done. He's a controversial figure. They don't want him to return to Tesla full time.
Was there a particular turning point? You know, he had all of this momentum at the start of his administration. So 100 days in, now we kind of examine it, and now he's stepping back. He's on his way out.
Yes, there was a turning point. It was in Wisconsin. It was when Elon Musk, we all saw, he put on a cheesehead hat. He donated $20 million of his own money for this hotly contested state Supreme Court race. A Democrat ended up winning. And this is kind of where he lost a bit of muscle. President Trump loves results. We know him by now. And Elon Musk didn't deliver. The voters didn't follow Elon. It has been a whirlwind 100 days. As you said, he has a lot of other companies, SpaceX, Neuralink. 2 of his companies merged. XAI, his AI company, merged with his social media company, X. Who knows what happens there?
Right.
We should check back in another 100 days.
Okay, we will. We'll check back with you as well. All right, Yasmin, thanks so much. Also, you can read more of the 100 days of Elon Musk through Yasmin's Substack, the Y-Axis. You can find it at yasminkhorram.substack.com. A lot of good information. I read that every day. Thanks so much. Appreciate it. All right. Since President Trump took office, DOGE has made cuts to research funded by the NIH, or National Institutes of Health. CBS News national reporter Karen Waugh is in Houston, a city known for its medical centers and research hubs, to explain how they are being impacted.
Hey, good to be with you. So hospitals all around the country, including here in Houston, they're bracing for impact. The NIH funds all sorts of research across the U.S., things from vaccine development to finding the cure for cancer. DOGE says its NIH cuts are mostly what they call indirect costs, things like lab maintenance and support staff. But researchers we talked to say those indirect costs are the foundation, the backbone of what they do. So these researchers worry that more cuts to the NIH could impact not only their science, but also could lead to some layoffs. In one example, we got a look inside Houston Methodist's brain tumor bank, run by Dr. Bob Rastamli. He extracts brain tumor tissues during surgery, then his team studies the samples to look for treatments. They currently have 5 projects that are funded by the NIH, so they get a couple $1 million a year. If their NIH funding is cut, Dr. Rastamli says they must find another source of money to keep serving their patients as usual. Not getting that money somewhere else is not an option.
And what the short-term consequences can be of the NIH and NCI issues, I don't know. But we just have to put our nose to the grindstone and keep moving forward as best we can.
Now, Houston Methodist's total budget is about $330 million a year. About 10 to 12 million of that is from NIH grants. Now, in comparison, down the street, Baylor College of Medicine receives the most NIH funding in all of Texas. They got $326 million last year, which they risk losing this year. Now today, the Harris County attorney, along with other Houston leaders, they're filing a lawsuit against the Trump administration over these federal workforce cuts. They do worry about these mass layoffs among federal workers and also these cuts to crucial things like medical research. They're hoping their lawsuit might at least stop some of these cuts in the meantime. Back to you.
The Trump administration also made sweeping changes to the Department of Health and Human Services. CBS News correspondent Nicole Valdes has the story from Nashville.
The city of Nashville is just one of many facing billions of dollars in federal cuts during President Trump's first 100 days in office. Some of the most impactful coming from the Department of Health and Human Services. It's cut more than $11 billion in federal public health funding across the country, terminating medical grants to support research and help states like Tennessee operate clinics and test for infectious diseases. The city of Nashville is now suing the department over the cancellation of grants it argues were already approved by Congress, and this cancellation, they say, exceeds constitutional authority. That suit was filed the same day HHS Secretary Robert F. Kennedy Jr. visited and spoke in Music City at a prescription drug industry summit addressing his past battles with drug addiction. Now, his speech was interrupted by several protesters against those funding and staff cuts to major organizations. Attendees there argue it's hurting Americans and access to health care.
Federal funding drives a lot of care and innovation, not only for the most vulnerable U.S. citizens, but also for everyday folks who maybe have different diseases or chronic illnesses. And the work that we all are doing is really important. I'd say that the people that work the hardest and work with the populations that are dealing with the most, they're always sort of feeling the brunt of it. So anytime there's sort of change or upheaval, even if some elements may end up being positive, it can be really challenging.
The public health director for Metro Nashville says he's concerned these cuts will impact funding losses on the health of the city's residents and worries the termination could impact the city's future ability to get grants approved.